This content is AI generated for informational purposes only and should not be directly used for clinical decision-making.
Hello and welcome back to the Neurosurgery Hub Podcast. I'm Dr. Aris, a senior attending neurosurgeon.
And I'm Dr. Elara, a research fellow. Today we're looking at a fascinating new study from the journal Neuromodulation, Journal of the International Neuromodulation Society, published in 2026. The paper is titled, Development of an Educational Curriculum for the Surgical Implantation of DBS Systems.
This is a timely piece, Elara. Deep brain stimulation, or DBS, has really expanded its footprint in our field. While we've traditionally focused on movement disorders, the indications have grown significantly.
That's right. The authors highlight that DBS systems are now being implanted not just for those classic movement disorders, but also for epilepsy and various psychiatric conditions. It's becoming a much broader tool in the neurosurgical arsenal.
And it's important to note the professional boundary here. As the paper states, neurologic surgery remains the only discipline credentialed to implant these DBS devices. We own this space, but with that comes a massive responsibility for standardized training.
Which brings us to the core problem the paper addresses. Despite being the sole credential discipline, there is significant practice variation across the board. The authors attribute this, at least in part, to heterogeneous training. Every program seems to be doing it a little differently.
I've seen that throughout my career. You have some residents who get a very high-volume, structured stereotactic experience, and others who might only see a handful of cases without a standardized approach. That lack of uniformity can lead to differences in surgical technique and, ultimately, patient outcomes.
Exactly. So to bridge this gap, the North American Neuromodulation Society, or NANS, Education Committee stepped in. They've developed what they call a granular recommendation for training.
I like that word, granular. It suggests they aren't just giving us a broad overview, but a detailed roadmap. How does the curriculum actually structure the progression of a trainee?
It's designed to guide a surgeon all the way from the early learner stage through to the practitioner level. It's a roadmap for the entire professional arc. What's really interesting is how they framed it. It's contextualized within the 6 core competency rubric.
The 6 core competencies. That's a framework most of our listeners, especially the residents, will be very familiar with. Applying that specifically to the surgical implantation of DBS devices is a smart move. It ensures that we aren't just teaching the manual dexterity of the procedure, but also the medical knowledge, interpersonal communication, and systems-based practice required for successful neuromodulation.
Right. By using that rubric, it aligns DBS training with the broader ACGME standards. The paper emphasizes that this curriculum provides a clear progression. It's about moving from understanding the basic anatomy and hardware to mastering the nuances of stereotactic planning and lead placement.
It sounds like this could really help eliminate that heterogeneous training issue you mentioned earlier. If programs across North America adopt this NANS curriculum, we can ensure a baseline level of excellence. Whether you're a medical student just getting interested or a senior resident preparing for practice, there's a defined path.
And for practicing neurosurgeons, it provides a benchmark. It's a way to assess our own practices against a national recommendation from a major society like NANS.
It's a necessary step for the field. As DBS applications grow, especially in psychiatric neurosurgery, the technical and ethical stakes get higher. We need a curriculum that is as sophisticated as the technology we are implanting.
Absolutely. The abstract makes it clear that the goal is to move away from variation and towards a unified, competency-based educational standard.
Well, that's a great summary of where the field is heading in terms of education. It's always good to see societies like NANS taking the lead on these granular recommendations.
Agreed. It will be interesting to see how this curriculum is integrated into residency programs over the next few years.
Thank you for joining us today, Elara. And to our listeners, thank you for tuning in to the Neurosurgery Hub Podcast. Stay tuned for our next episode where we continue to dive into the latest literature shaping our specialty.
See you next time.